Hi, my name is Sybil, and today we're going to be performing an examination of the chest and lungs on our patient. I'm going to start with a quick history. Have you had any coughs recently?
No.
Any history of respiratory infection like pneumonia, bronchitis?
Yes, in the past.
In the past, but not recently?
No.
Okay. Any history of lung disease like COPD or asthma?
No.
Okay. Have you had any shortness of breath recently?
No.
Or any trouble breathing?
No.
No. Okay. Have you had a TB test
Yes.
in the past and the result was?
Negative.
Okay, good. And have you had a chest x-ray recently
Yes.
and the result was?
Normal.
Okay. Have you had your pneumonia shot
Yes.
vaccine the
Yes.
past 5 years? Okay. And the flu shot, have you had that this season?
Yes, I am.
Okay, good. And are you a smoker or ever been a smoker?
I was a smoker. I'm not anymore.
Former smoker. Okay, very good. Okay, I'm going to begin the examination. I begin by inspecting the patient, and I see that her breathing is regular, it's even, it's unlabored. I had noted her breathing rate when she came in and I took her vital signs, and then it was 18, and that is within normal limits. Looking at her color, and I see that it is normal. There's no pallor or cyanosis noted, and I am seeing that everything looks, her chest looks symmetrical to me. I'm going to look at your trachea, and I note that it is midline, okay, and I can feel the suprasternal notch and the angle of Louis, intercostal spaces. I'm noting that her ribs are, I can feel her ribs, but they're not prominent. She's well nourished, and I don't see any prominent veins in the chest, okay. I'm going to palpate kind of all over for any masses or tenderness. I don't feel that. And crepitus, she's breathing normally. I don't feel any crepitus. I'm going to now palpate for tactile fremitus. I'm going to ask you to repeat the words 99 every time I touch you with my hands, okay?
99. 99. 99.
Okay. And I don't feel, well, I feel the resonance of the fremitus, and it's symmetrical side to side, okay? I'm gonna, while I'm down here, I can feel the costal angle of the ribs, and I note that it is normal within 90 degrees, okay? I'm gonna come around to the back. Again, I'm gonna palpate all over for any masses, tenderness, and crepitus while she's breathing normally, and everything feels good. Going to again palpate for tactile fremitus, and if you'd repeat the words 99 each time I touch you.
99. 99. 99.
Very good, and that feels normal. It's a symmetrical side to side. I'm going to percuss in all fields from side to side, and I note that it is resonant. Just lean forward a little bit for me, dear. Okay. Good. Okay. And that's symmetrical side to side. I'm going to test for thoracic expansion. While I hold my thumbs here, I'm going to ask you to take a deep breath in and out. And I note that my thumbs move symmetrically, and she has good expansion. The next thing we're going to test for is the diaphragmatic excursion. I'm going to ask you to lean forward again a little more. Okay. I'm going to ask you to take a deep breath and hold it. Okay. I'm going to percuss down where it sounds dull, right here. Okay, you can breathe normally. I'm going to mark that spot. And then after a couple more breaths, I'm going to ask you to exhale fully and hold your exhale. Okay, and holding that, I'm going to percuss up to where I hear resonance, right there. Okay, you can breathe normally. I'm going to mark that spot. And I'm going to measure. And that is 4.5 centimeters, and that is within normal limits. Okay, next I'm going to auscultate with my stethoscope. I'm listening for any adventitious sounds like wheezes, crackles, or rhonchi. Going to listen side to side, deep breath in and out. Okay, and I note that it's no adventitious sounds are heard. I'm going to now test for vocal resonance, and I'm going to ask you to repeat the words 1, 2, 3 each time I touch you with my stethoscope.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, good. And I note that the sounds are muffled, and that is the normal result. I'm going to come around to the front, and again, I'm going to percuss side to side. Ask you just to lean back a little bit. Okay, and then if you would just lift your arms up, I'm going to get over to the side. Good, and I note that the sounds are resonant and they are symmetrical side to side. Next, I'm going to auscultate, and if you would just breathe in and deep breath in and out. Okay, good. And no adventitious sounds are heard. And I'm going to also, again, test for vocal resonance. You'll say 1, 2, 3 each time I touch you with my stethoscope.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay. And the sounds are muffled again. That's the normal result. Okay, and that concludes our examination of the chest and lungs. Thank you.